So I'm gonna knock. I immediately provide for privacy for my patient. I'm gonna introduce myself to my patient. Hi, sir, your patient. My name is Bitsy. I'm the LPN that's gonna be taking care of you today. I'm gonna go ahead and check my doctor's order. It appears that he has written for a ice pack to go onto your left ankle. Do you have any allergies to medicines? Okay. And the ice pack is gonna go on for 20 minutes. I'm gonna come check it every 5 minutes to make sure that there is nothing wrong with your skin and that everything is okay. I'm gonna go ahead and wash my hands, and I'm gonna put my gloves on.
And so this is pretending to be like St. John's Stanley for disinfectant. So first I'm going to look it to see. This is what happened. What did I do?
I'm going to expose only the area that is needed. I'm gonna place a towel under the leg. I'm gonna check the temperature to make sure this is at 59 degrees Fahrenheit. I'm gonna place a towel between the ice pack and my patient's skin to not cause any irritation. I'm gonna secure the ice pack to his leg. Is that comfortable for you, Mr. York? Okay, I'm gonna go ahead and cover him up, and I'm gonna come back and check his skin in the next 5 minutes. In the meantime, I'm gonna go ahead and document everything that I'm doing. And the physician has also ordered you to be given Narco 5325, 1 or 2 tabs, PRN for pain. I'm gonna go ahead and administer that. I would set my patient up, go ahead and check my order, administer the medication, allow him to lay back down in a position of comfort. After the medication has been administered, it's been 5 minutes, I'm gonna recheck the skin on my patient. Everything looks good. The ice pack is still in place. And I would continue to reassess every 5 minutes until the 20 minutes is up. I would take off my gloves, leaving the room, wash my hands. And when I come back in, I'm gonna recheck again. This time when I come back in, it has now been 20 minutes. It's time to remove the ice pack. Mr. Patient, how are you feeling? Okay, well, I'm gonna go ahead and remove your ice pack. It's been 20 minutes. Is your ankle feeling any better? Good, glad to hear that. I am observing the ankle to make sure that the skin is cool from the ice pack, but not too cold, and that there is no reddening or swelling, and that his pulses and motor function is still good. He's able to feel me touching his toes. I'm gonna go ahead and cover him back up. Mr. York, they've ordered a Foley catheter to be inserted into your bladder. I'm gonna go ahead and gather my stuff. Do you have any allergies to latex or anything? Good. I'm gonna go ahead and raise my bed to keep me from injuring my back. Okay, bed is now high enough. I'm gonna go ahead and all right, I'm gonna gather my Foley. And I'm going to come onto this side so that I'm on my dominant side. So the first thing that I'm gonna do is I've explained to my patient what I'm gonna do. I'm gonna go ahead and put on some gloves after washing my hands. And I am going to perform peri-care on my patient. So I am going to expose just the area that I need exposed. And I'm gonna grab my bath blanket to give him some warmth and some privacy. I am going to perform peri-care, cleaning in circular motion around the patient. Once the patient is clean, I'm going to dispose of my dirty linen, and I'm going to dispose of my gloves, and I'm going to set up my sterile field. I'm going to open away from me. And I'm going to take my I would open my lubricant, put it here. I would check my balloon to my company's discretion or the manufacturer discretion, making sure that the balloon does work. And I would open and cleanse, cleaning in a circular motion from the meatus outward 3 times, disposing of my swabs. And then take my bag, keeping this sterile. Dip it into my lubricant, holding at a 90-degree angle, insert until I see return, approximately 7 to 9 inches. Once I see return, holding securely, I would inflate my balloon. Once the balloon is inflated, I'm going to pull back until I can feel resistance, and that would let me know that I'm in the right spot. So I would tape it securely to the patient's leg, remove my dressing, shield, removing all this, and I would take the bag and secure it to the side of the bed and keep the bag hanging lower than the patient so that the bladder will drain. Once that is attached to the side of the patient, then I would cover my patient back up. Removing the bath towel. making sure that Mr. Yort is comfortable, and explained that he may feel some burning or irritation down there, that's normal. He may feel some pressure like he needs to urinate. That's normal too. If he's got any other concerns, he can push his call light, and I'll be more than happy to answer any questions. That time I'm gonna take off my gloves, wash my hands, and document. Then, once I am done with that, the next step is the wound irrigation. So I'm going to gather all my supplies for the wound irrigation, which would be sterile gloves, tape, my Q-tips, my saline, my dressings, and also regular gloves. And once again, I walk into the patient's room, I perform my wipe, pride for privacy, wash my hands, explain to the patient what I'm going to do. At this time, the doctor has also ordered a wound change to be done every 4 hours, and I'm going to go ahead and assess for pain. I am to wait 30 minutes after medication has been given to my patient to make sure that his pain is okay and he can tolerate the procedure. I'm going to ask him his pain level. Right now he rates his pain a 3 out of 10. I've got my supplies. I've washed my hands. I'm going to go ahead and put on my gloves. And I'm going to observe his wound. I'm going to take off the dressing. Observing whether or not there's any color on his dressing. Take off this, take off this. At this time I notice that there is some sanguineous area, no odor, no sinus tracts, and I am going to measure using my side of my Q-tip, and it's approximately 2 inches in width, and I'm going to use my Q-tip to measure the approximate depth, and I'm gonna say it's approximately 1 inch there. I would dispose of my Q-tip, and I'm gonna go ahead and make note of what my observations were. I'm gonna change my gloves. I'm gonna wash my hands, and I'm gonna come back, and when I come back, I'm going to go ahead and apply my sterile settings. So I would open up my Q-tip for packing.
Also, we're going to be coming back and checking on this every 5 minutes just to make sure.
I'm going to open up my dressing, leaving it sterile. I'm going to go ahead and pour some saline into it, and I'm going to go ahead and apply my sterile gloves. Keeping my sterile field, I am going to take my dressing
Every time I'm doing it, I'm always assessing the drainage.
and fluff
On top, color, if there's a
and clean from the wound gently, disposing, and if needed, I would clean it again. Disposing. And then I am going to take the next one, fluff it,
Tell me your name and your date of birth, please. Mr. Dowd, let's go ahead and get this ice pack off the table.
and using
You want
my sterile Q-tip, I would gently insert the dressing.
Okay, Mr. Donna. I'm gonna go ahead and start your test if there's anything sticking to it, write your pain again for me. 0 being the least and 10 being the worst.
Once I have filled the whole of it,
So now we want to clean our
I'm going to take and fold a dressing on top, dispose of that. I would place my ABD dressing on top, and I would secure my tape if I can open my tape.
And I'm going to come around and pour the serum into the gauze because we were doing the
And I would do my edges first.
And then I'm going to open this and then after, just so that
Do the other edge.
Okay, so right now, all I'm gonna do is, and then open it, just like, and then, hand me after, okay? I'm gonna check my package. Expired.
And then on a piece of tape, I would write today's date, which is the 29th, my initials, and the time that I have done this, which is 13:30. And I'm going to place that on my dressing. I would then clean up my mess, dispose of my gloves, place my patient comfortably. Are you doing okay, Mr. Yor? Good. I'm going to go ahead and put the bed in lowest position, make sure that my patient has his call light. I'm going to wash my hands, leave, and document my procedure.